Hello class and welcome to another exciting facilitation for this semester. I am Dr. Annie George, Department of Public Health, Faculty of Health Sciences, and will be your guide. Hope we all enjoy it. Thank you.
So, today's lecture is going to be on essential drugs, PHS 426. We will be looking at topic 1, concept of national drug policy and national drug formulary. At the end of this lecture, we should know what drugs and essential drugs are in public health, understand the goals and objectives of national drug policy, know the targets of national drug policy, as well as the primary strategies for implementing national drug policy in Nigeria. We should also understand the regulations for prescribing and dispensing medicines and the national drug formulary. So, what is a drug? The title of our course is Essential Drugs and Public Health Pharmacology. So let's start by saying, what is a drug? A drug is any substance or mixture of substances. Either is manufactured or is sold or is even advertised, that is used in diagnosis of ailments, treatment of such ailments, or prevention of diseases. Whether it's in disease disorder, abnormal physical state, or even symptoms, it has to be in a man or in an animal. It can be used for restoring, correcting, or modifying organic functions. It's also used in disinfection, control of vermin, insects, or pests. It can also be used in contraception. So these are uses of a drug and what we know a drug as. Activity 1 brings us to what we call essential drugs in public health. So we now know what a drug is. So what makes such a drug an essential drug? So essential drugs in public health, what makes them essential? The word essential is that they have to satisfy the healthcare needs of the majority of the population that use such drugs. That makes it essential. It's also essential when it's in adequate amount at all times and always available. Not just that it is available, it's also in adequate amount at all times. It should be in appropriate dosage forms and must be affordable to the community that use it. So these are the attributes of an essential drug in public health. So what is national drug policy? When you have an essential drug culminating from national drug policy, what is that national drug policy? National drug policy is simply a guide for action. It's a document that states the goal set by pharmaceutical sector, a framework for coordination of activities by various partners of the pharmaceutical sector, the public sector, the non-governmental organizations, the private sector, the donor agencies, and other interested parties. So such documents that state such goals that guide them in administration or manufacture of drugs or use of drugs, those essential drugs, is what we call the national drug policy. So the goal of national drug policy is that drugs should be made available at all times to the entire citizenry or to the population that use them in adequate amount. Such drugs should be supplied in adequate amount in such a way that such drugs are effective, they are affordable, they are safe, and they must be of good quality. The goal is also to ensure that there is a rational use of such drugs. Rational use prevents people from over-prescribing or under-prescribing or practicing what we call polypharmacy, multiple drug prescriptions. The goal is also to stimulate increased local production of essential drugs. Let people manufacture such drugs locally. So, by extension, the objectives of national drug policies is a kind of an expansion of the goals to now state that such drugs must be efficient and effective in terms of its management. Pharmaceutical and herbal medicine research should be promoted. Administrative and legislative capacity of such a country in control and manufacture and distribution of drugs should be strengthened. Such drugs should be available. People should have access to it, and it should also be affordable. And like I said earlier, it should also promote local manufacturing and distribution of drugs. So what's the targets of national drug policy in Nigeria? It was adopted in 1990, and that led to a couple of items that were meant to be targets, achievements to be made when it was adopted. And one of these achievements to be made is to make sure that the National Drug Policy Monitor and Evaluation Division is established in the Federal Ministry of Health by the year 2005. Several years have passed now, and that has actually culminated in the establishment of NAFDAC, National Agency for Food, Drug and Administration in Nigeria. So they regulate food and drugs, and that has helped to achieve that target. Also, there should be total adherence to the use of essential drug list in the public health institutions by 2008. 80% adherence to good drug procurement practices in the public sector by 2008, as well as awareness of appropriate self-medication practices by 40% of the population by 2008. How far have we gone with all this? This brings us to primary strategies for implementing national drug policy in Nigeria. What are those primary strategies for implementing national drug policy in Nigeria? Number one is that when you're selecting drugs, you must make sure that such drugs satisfy needs of the population before they are being selected. When you want to buy or procure drugs, you must make sure that such drugs are safe. They must do what they are supposed to do in terms of efficacy, must be of good quality, must be affordable, and must always be available to the people. And such drugs must be subjected to quality assessment, and that's what NAFDAC does. So these are the things you check before you procure drugs. Then there's another aspect in implementing national drug policy called Drug Revolving Fund Scheme. Now, this scheme is simply a scheme that ensures that people get initial grants. People who participate in the fund get initial grants from government, and the whole essence is that when they sell such drugs they have procured, they usually buy them in bulks. When they sell such drugs, after procuring them, the funds raised from sales of such drugs are plowed back into the system in purchase of another drugs. So it becomes a recycling of funds. So that's why it's called a revolving fund scheme. So the money made from sales of that initial grant is plowed back, and then the cycle continues so that people continue to have replenishment of the drugs or essential drugs in their system or in the health system. Another strategy for implementing national drug policy is what we call the pricing policy. It's simply government regulation of drug prices. Drugs should be low prices everywhere. Drugs in Lagos should be of the same price with drugs in Abuja, and even within the same city, the drugs should be the same. That's what we call price equity. When drugs are stored and distributed, there must be stock security in terms of replenishment of the stocks. The stocks must always be there, replenished. None should seem to be depleted. And such stocks must be of good quality when they are stored and distributed. Then there should also be rational drug use. Drugs should be prescribed when they should be prescribed and should be prescribed appropriately. They should not be underprescribed or overprescribed. These are the things that ensure rational drug use of drugs. So what are the regulations for prescribing and dispensing medications and what we call the pharmacovigilance? Prescribing medications in Nigeria, we have the secondary and the tertiary healthcare systems. The people who are allowed to prescribe in the secondary and the tertiary healthcare systems are trained medical personnel that are approved to prescribe medications at this level. At the primary healthcare centers, you have people that are trained by government, called the government designates, that should prescribe medications, like the community health officers, the community health extension workers. These are people who are trained and allowed to prescribe medications on the essential drug list. And such prescriptions must be done with generic names of the drugs, not the trade names. When it comes to dispensing medications, the people who are approved to dispense medications are the trained pharmacists. Now, there are other categories of medications that can be dispensed at what we call the patent medicine stores. They are called the over-the-counter medications, OTCs, like paracetamol, and common cold medications and all that. Those are not prescription medicines. Pharmacovigilance is a duty of all health professionals. Pharmacovigilance means simply monitoring and reporting adverse reactions of drugs. Now, every country has what we call the adverse drug reporting system. This adverse effect or drug adverse effect reporting systems in every country. In Nigeria, we have the pharmacovigilance reporting center with NAFDAC. So it is the duty of all health professionals to report such cases of adverse drug reactions to that center. So activity 2 brings us to National Drug Formulary. What is National Drug Formulary? National Drug Formulary is simply a list of approved prescription medicines in a country. In every country, there is a list of approved prescription medicines. That formulary has the list of such approved prescription medicines. In that formulary, it shows the key. You get all the information you need in terms of composition of such medications, the selection, description, prescribing, dispensing, and administration of such medications. The objective of the drug formulary is to promote rational use of drugs. It also serves as a teaching aid to medical personnel in training and even those who have graduated. It guides them in prescribing medicines. Examples of such drug formulary is MDEX in Nigeria, and then what we call the BNF in the UK, the British National Formulary in the UK. We've learned what drug is and the essential drug component of it in public health. We know the goals and objectives of national drug policy and targets, and also the strategies for implementing national drug policy in Nigeria. We've also understood the regulations for prescribing and dispensing medicines, as well as the national drug formulary. In our next lecture, we shall look at management of essential drugs and the supply system. Thank you for listening.